Hi, I'm Dr. Michael Gartner, double board certified plastic surgeon, and I've been asked to react to this video, what it's like to get a chemical peel for acne scars. So many people get chemical peels for acne scars. You can also get laser procedures. I actually prefer lasers, especially something called a profractional treatment, which drills tiny holes in the skin. The idea is you destroy the whole surface of the skin, and when it grows in without any acne scars. Usually you can get like a 90% to 80% improvement with 3 treatments.
Ooh, it burns.
This is what it can sometimes look like around the 4th day or so with certain chemical peels. It almost looks like you had glue put on your glamorous glue put on your face and now it's coming off.
Today I am doing a chemical peel on my face. I have struggled with acne growing up and some adult acne, and it's left me with a lot of acne scars and large pores. I have been delaying this treatment for so long only because for 1 week my face is gonna peel off and it's gonna be really scary, so I'm a little nervous.
If it's interesting, if you look closely, you can still see a lot of acne scars still there. So it looks like to me she had a very superficial chemical peel, and sometimes what you see peeling is that not actually peeling. So they put the chemical on, then they put the reducing agent on, and then they cover the skin with a type of emollient, which is kind of like an Elmer's glue, which kind of fades, pushes off as the skin regrows. So this is sometimes what you're seeing peeling here in this dramatic fashion. It's not actually her skin coming off.
Takes about 20 minutes and costs $295 per treatment.
Overall, you'll see your skin a little bit shinier, a little bit better. It helps the turnover of skin better, but there's not a tremendous amount of benefit to these. These are more like spa kind of things that make you feel better.
It is a chemical peel specifically for pigmentation. It has a lot of acidic ingredients to help kind of brighten up the skin.
So these pigmentation peels, if your pigmentation is superficial, these can help. But if it's deeper, it's just temporarily gonna take the edge off and you're gonna get that pigmentation right back.
The first step is putting a prepping solution on your face, which is actually acetone, to get the skin completely clean. The next step is the peel. The solution is applied over the entire face with one quick pass to lay down the product.
Does this smell too?
It kind of does. You'll probably feel it more so.
Whoa, it is stinging. Ooh, it burns.
So that's the first pass.
So she has some significant acne scar then. This peel is going to do very little for those heavier scars, quite frankly, even with 20 treatments.
Go ahead and really just kind of push this product into the skin to help brighten that up. Done.
Done.
You're done.
That was fast. Painful, but fast. 8 hours post-treatment, my face is itchy, it's red, and I have a little bit of a headache. I can't wait till the peeling starts and stops.
On day 2, I started my post-care treatment. I washed my face in the morning with the cleanser they provided, then I went in with the post-peel towelette. It didn't burn or sting, instead it felt very cooling on my face, but it didn't smell too delightful. After, I put on the provided moisturizer.
It feels like you're putting Neosporin, whatever.
And finally, SPF.
It feels just pretty tight.
With any skin peel, you will feel temporarily tighter the first week or two. That happens with any superficial peel.
Feels like, but I feel like it would feel like that. Who knows?
As expected, on day 3, my skin started to peel around my nose and mouth. The peeling area felt very itchy, and the rest of my skin that wasn't peeling felt very tight and dry. Throughout day 3, the peeling got worse, but that's nothing compared to day 4. I couldn't let all my dead skin just flap around town, so I carefully cut off some of the larger pieces without pulling on my skin. It's super important to let your face naturally peel off to prevent any scarring.
That's true. You never want to peel the skin completely off. What she's doing is 100% right. Just trim it with a scissor.
By day 5, the peeling moved up to my forehead, eyebrows, nose, and around my neck. Once I washed my face and put on moisturizer, I kind of liked the way my new skin looked. It seemed very fresh and dewy. After a full week, the heavy peeling had stopped and I mostly had little flakes around my hairline, ears, and neck.
So this is 9 days post-peel, and although my skin is still recovering, the peeling storm has passed, so I thought it would be a good time to give my final thoughts. I am in a love-hate relationship with this treatment. The minute my skin started peeling, the new skin felt so fresh and just so reborn. And then throughout the days, it kind of got a little dry and flaky, so I kept putting moisturizer and SPF on like they told me, so that helped a lot. I have a few new pimple friends joining us today right around here, but I read online that that's completely normal post-peel or post this intense facial. So it will go away. It's just my pores that are kind of like getting rid of all the gunk that's in there. Now we're 2 weeks post-treatment, obviously, and my face is completely healed, so I thought this would be a good time to do my final review. While the treatment did make my skin feel smoother and look a lot brighter, did it heal my acne scars and large pores? I would say no.
These superficial peels, if you're expecting them to completely take care of things, they're superficial. They're actually not bad for maintenance. So if you have 2 or 3 of these done a year, it can help maintain your skin. It's not necessarily going to turn the clock back, but it'll help slow down the aging process. And like I said, you could have 10 or 15 of these or 20 or 30, and in my opinion, it's just never going to take away those type of acne scars and pores she had. So if you like these videos, subscribe to my channel and hit that notification bell. We'll see you at the next video.